A luxury cruise turned deadly, a rare virus spreading at sea, and passengers trapped with no escape. What began as a dream voyage is now a floating nightmare. 3 lives lost to Hantavirus, more under investigation. As authorities scramble to contain the outbreak, one chilling question looms: how far has it already spread? A deadly outbreak at sea, a rare virus on board, and passengers trapped far from shore. What began as a luxury voyage across the Atlantic has turned into a floating health emergency, raising urgent questions about containment, survival, and how far this silent threat has already spread. 3 people have died following a suspected hantavirus outbreak aboard a cruise ship sailing in the Atlantic Ocean, according to the World Health Organization. At least 1 case has been confirmed, while 5 more remain under investigation as health authorities race to understand the scale of the incident.
Who is aware of and supporting a public health event involving a cruise vessel sailing in the Atlantic Ocean? To date, 1 case of hantavirus infection has been laboratory confirmed, and there are 5 additional suspected cases. Of the 6 affected individuals, 3 have died and 1 is currently in intensive care in South Africa. Detailed investigations are ongoing, including further laboratory testing and epidemiological investigations. Medical care and support are being provided to passengers and crew. Sequencing of the virus is also ongoing.
The outbreak occurred on the MV Hondius, a Dutch-operated cruise vessel travelling from Argentina to Cape Verde. The ship had been on a weeks-long journey that included stops in Antarctica, the Falkland Islands, and other remote locations before the health emergency unfolded. The first reported victim was a 70-year-old man who died on the ship. His body was later removed at St. Helena, a remote British territory in the South Atlantic. His wife subsequently collapsed at an airport in South Africa while attempting to return home and later died in hospital. A 3rd fatality has also been reported, with the body still on board the vessel as it remains off the coast of Cape Verde. 2 additional individuals, believed to be crew members, are reportedly in need of urgent medical care, though local authorities have not yet approved their transfer ashore.
Yeah, unfortunately, there are no specific vaccines for hantaviral diseases. There are no specific antivirals to treat the disease in humans with. Treatment primarily is supportive care, so early identification of cases, seeking medical attention, and getting into facilities that are capable of assisting, for example, in this case, with the respiratory distress portion of the disease. That's really critical, but specific medical interventions, just nothing exists at this time.
Around 150 tourists and approximately 70 crew members were believed to be on board at the time of the outbreak. Health officials in South Africa have begun contact tracing efforts, particularly in Johannesburg, where 1 infected passenger is currently receiving intensive care treatment. Hantavirus is a group of viruses primarily spread through contact with infected rodents, particularly through inhalation of airborne particles from urine, droppings, or saliva. While rare, the infection can be severe and potentially fatal. The virus is known to cause 2 major illnesses. Hantavirus pulmonary syndrome affects the lungs and carries a mortality rate of around 38%. It typically begins with flu-like symptoms such as fatigue, fever, and muscle aches, before progressing to respiratory distress. The second condition, hemorrhagic fever with renal syndrome, affects the kidneys and can lead to internal bleeding, low blood pressure, and acute kidney failure in severe cases. There is currently no specific cure or targeted treatment for hantavirus infections. Medical care focuses on managing symptoms, including oxygen therapy, ventilatory support, and, in critical cases, dialysis. Global data suggests that approximately 150,000 cases of hantavirus-related illness occur each year, primarily in Europe and Asia. However, outbreaks on cruise ships remain extremely rare, adding to the concerns surrounding this incident. Health authorities emphasize that early detection and supportive care significantly improve survival chances. Preventative measures focus on reducing exposure to rodents and avoiding contact with contaminated environments. Three passengers are dead while hundreds remain trapped on board as a Hantavirus outbreak on a cruise ship in the Atlantic Ocean has sent shockwaves through global health authorities. The MV Hondius, a Dutch-flagged polar expedition vessel operated by Oceanwide Expeditions, departed Ushuaia, Argentina 7 weeks ago, making stops in Antarctica and the British territory of St. Helena before anchoring off Praia, the capital of Cape Verde. Last year, prices for a full trip on the vessel were up to $48,000 for the most luxurious private cabin. The first victim, a 70-year-old Dutch national, died at sea near St. Helena. His 69-year-old wife collapsed at a South African airport, attempting to fly home to the Netherlands, and died shortly afterwards in a hospital near Johannesburg. A third passenger has also died, their body still on board. A 69-year-old British national, who has also taken ill and tested positive for Hantavirus, is currently receiving treatment at a private facility in Johannesburg. 3 further suspected cases remain under investigation.
We are closely monitoring reports of a potential Hantavirus outbreak on the cruise ship Hondius and stand ready to support British nationals if needed. We are in touch with the cruise company and local authorities.
What has intensified the alarm is this. Cape Verdean authorities have refused to grant disembarkation clearance, even for 2 crew members described as requiring urgent medical care. Hundreds of people remain sealed on a vessel with a confirmed deadly pathogen, anchored and going nowhere. Hantavirus spreads through contact with infected rodent droppings, urine, or saliva. It causes severe lung and kidney failure. There is no cure. The fatality rate in respiratory cases can reach nearly 40%. Critically, one strain, the Andes virus, can transmit between humans. It originates primarily in Argentina, where this voyage began. The ship is operated by the Dutch tour company Oceanwide Expeditions and holds 170 passengers and 71 crew, including only 1 doctor.
The priority of Oceanwide Expeditions is to ensure that the 2 symptomatic individuals on board receive adequate and expedited medical care.
The Dutch government has agreed to lead the repatriation effort. The WHO is coordinating medical evacuation logistics whilst virus sequencing remains ongoing. Britain's Foreign Office says it is closely monitoring the situation and stands ready to assist British nationals. Medical experts are growing louder in their warnings. Dr. Miskovich, CEO of Premier Medical Group, was blunt.
When I first read this, I thought that they were making a misprint. If I were being brought into this, the very first thing that needs to happen is that the ship needs to be taken to shore. And basically everyone needs to be off the ship, and they need to be evaluated.
Now 3 are already dead. Hundreds are unsure what will strike them first, a rescue or the deadly mystery virus. No answers yet. The MV Hondius sits anchored off West Africa tonight, and this story is only just beginning.